If you're in a room with a group of people and everybody starts feeling bad at once, think about, could this be carbon monoxide poisoning, and get out. My name is Dr. Bruce Campana. I'm one of the hyperbaric physicians here at Vancouver General Hospital at the Hyperbaric unit. The hyperbaric chamber is a large steel chamber here at the unit. We use it to treat a variety of things, including carbon monoxide poisoning. What happens is it gives highly concentrated oxygen to a patient. You and I are breathing 20% oxygen right now. In the chamber at 45 feet, you're breathing 250% oxygen. And that's useful for things like carbon monoxide poisoning and diving accidents. Carbon monoxide poisoning is very sneaky. So one of the signs can be that you collapse and die. But most of the time, people have warnings. They have headaches, they have nausea, they may have vomiting. If you don't correct it, if you don't get out into fresh air, that can progress into seizures, loss of consciousness, and then death. There's a condition of chronic carbon monoxide poisoning where somebody might have intermittent exposure over days to weeks, and the research isn't clear on that yet, but there's certainly evidence that they can have significant damage from that. It's not clear whether or not hyperbaric oxygen helps that, but it is clear that those people do get sick and that they can have permanent neurologic damage from a chronic recurring exposure. In a year, we'll get 20 to 40 patients here in the chamber. Now that number is different in emergency, where they'll often get other patients that aren't as severely poisoned. So if somebody has a mild exposure, maybe they get nauseated, they get a headache, they can be treated in emergency with oxygen. People that are unconscious, have a seizure, or in trouble, come to the chamber. Sources for CO poisoning depend on the season. In the summertime, it's different. They're trying to have fun. And it comes down to cabins, boats, and camping. Cabins, people often run into trouble with old propane appliances. The cabin maybe isn't maintained as well as the house, and we can get problems from, say, a propane fridge or freezer. Camping, people sometimes, if it's a rainy day and you want to do your cooking, but you don't want to do it out in the rain, people bring their cook stove into the tent. That's a really bad idea, and people have gotten in trouble from that. Set up a tarp outside. Yes, it's miserable, but it's better than getting sick inside your tent. And the final thing is boats. People think you're outside in a boat, what could possibly go wrong? We run into all kinds of things, like houseboats where they have a generator running overnight and people get poisoned or die from the fumes from the generator. We've even had people being towed behind a boat in a tube who got carbon monoxide poisoning just from the exhaust of the boat because they were too close to the boat. Carbon monoxide poisoning can be tricky because it resembles a flu-like illness. It resembles a hangover. It acts like food poisoning. But basically, if you're in a room with a group of people and everybody starts feeling bad at once, headache, nausea, dizziness, think about the possibility of carbon monoxide. If you're in an area where you're by yourself, but there's a source of combustion, maybe there's an old stove, maybe there's a barbecue, maybe there's an engine running nearby. Think about, could this be carbon monoxide poisoning, and get out. Get out to fresh air where you can call for help if you need it, call 911, fire department has carbon monoxide detectors. The important thing is get out and get everybody who's with you out of that area.